Hello everyone, welcome back to my channel. I hope you're all doing very well. This video is a bonus video because today is Friday and someone has asked me, or two people have actually asked me to talk about the difference between senior carer, healthcare assistant or care assistant, auxiliary nurse, and they're thinking, what is the difference? So basically this evening I've decided to do a video on that, so that's what I'm going to be talking about, so you need to keep watching. Hello everyone, welcome back to my channel. My name is Becky Sechere. If this is the first time you have come across my video, I'm a nurse and I do YouTube videos giving tips and advice about nursing in the UK, senior care work and all that. And if you haven't subscribed yet, please remember to subscribe, and if you are a returning subscriber, thank you so much. So let's go to the point now. So I'm going to be talking about healthcare assistant first. As I said in the intro, somebody has asked me to talk about the difference between all these things. So basically, healthcare assistants, usually I would say they work in hospitals, they work with nurses, doctors, midwives. They could also actually work in general practice or GP surgeries as well. Caregivers, I think, is an American term for healthcare workers or healthcare assistants or carers, but I'll go more into that later. So now let's talk about healthcare assistants. As I said, they work under the guidance of a nurse, doctor, midwife, or other health professionals. Their jobs vary based on where they are. So if they're working in a hospital, their duties include washing and dressing patients. They help serve meals to patients. They work on the wards. They help make beds. They help with feeding. They make sure patients are comfortable. They make sure or they monitor patients' conditions by doing blood pressure, temperature, respiration. They monitor urine input and output as well, or fluid intake and output as well. And then apart from that, those that work in a GP surgeries, what do? They help with sterilization of equipment. They help to restock the consulting rooms. They do health promotion activities. They process samples for the lab from the general practice. Some of them, as I said, they take blood samples as well. They do health promotion, previously, as I said, they help with nurses. Actually, they support or they work under the guidance of nurses. What are the requirements for someone to become a healthcare assistant? There is no set requirement for healthcare assistants. However, most employers look for people with good communication skills. You can speak English, you can write English, you can take instructions, and then people with GCSE, English and Maths actually, or BTEC or NVQ. Experience in care setting, is advantageous. In the UK, there are apprenticeship programs that people can go on to help them gain that care, working in healthcare environment experience. What are the skills that they look out for? Some of the skills and characteristics of someone who is a healthcare assistant should be someone who is very kind, someone who is compassionate, good communicator, you have good organizational skills, you are friendly, you are a team worker, you are hands-on because you'll be washing and dressing patients and helping patients who cannot mobilize. You're going to be helping with toilet needs of patients and continent needs of patients as well. And then you'll be somebody with good observational skills as well. Most often training is given on the job. Most of these things you get the training on the job. what is the salary of healthcare assistants? Those working in the NHS, working without any extra. The salary I'm going to be talking about is without any unsocial hours, extras like working on Saturdays or nights or doing your extra shifts. This is exclusive, so or excluded, I would say. So they work 37.5 hours in a week. They're entitled, so their working pattern, 37.5 hours in a week. It could be earlys, it could be late, it could be long days, it could be night shifts, you could be working Saturdays or Sundays. But if you're working in general practice, they actually work Monday to Friday, and their working hours vary from surgery or practice to practice. So the annual salary, so they are on Agenda for Change Band 2. That is the starting point. So when you start as a healthcare assistant in a hospital, it could be community hospital, acute hospital, or working in a general practice. General practice, sometimes their salaries are negotiable. So I'm talking about the NHS. So basically their annual salary. So the annual salary of a healthcare assistant in a hospital based on 37.5 hours a week is now, where am I? It is £18,525 per annum, and take home is £1,286.80. So about £1,286 is their take home salary. Now, as you know, you grow with experience. So when you get to the top of band 2, their annual salary is £19,917, and their take home after deduction is £1,359. They're entitled to 27 days leave, annual leave, in addition to bank holidays as well. What opportunities are there for healthcare assistants? So if you are a healthcare assistant for some number of years and you're thinking, is that what I'm going to be doing for the rest of my life? No, there are opportunities. You can go ahead and train as a nurse. So in nursing, you can train as an adult general nurse, pediatric nurse, learning disability nurse, or mental health nurse. You can go into social care or all other, so professions. I was going to say you can study to be a radiographer if you want to take that route, because some of these courses, they want you to have some caring experience. So this would be like a springboard for you to go on to something else. So the next group I'm going to be talking about is care workers or care assistants. So most often care workers or care assistants is similar to healthcare assistants, but most of them work in different settings as well. It could be working in a community, in somebody's home. You could be working in a daycare, care homes, residential homes, and different other community settings. They normally support people with eating, dressing, toileting, and it's just similar to someone who is working in a hospital with people on the wards. But with this one, you're working and meeting the individual needs in their own homes or in a care homes in a different setting, I would say. They help with shopping sometimes, some help with cooking, washing, toileting. Sometimes they help to prompt people to take their medication. So there are a lot of different things that they do. What are the characteristics of someone who wants to be a senior, or not a senior, care assistant or healthcare worker or care worker, I will call it, or carer. Some people call it a carer. You should be kind, compassionate, good English again, good numeracy skills. You should have good organization skills as well. Normally, some employers want GCSE A to C in English and maths. Most often there is no set qualification again, but if you have all these, it's helpful. Sometimes some employers want level 2 or 3 in health and social care or diploma in health and social care, most often training is offered on the job. Now, the next one is senior carers or senior care worker. They usually is more or less like a supervisory role. So you are supervising the care assistants or carers to make sure they're doing the right thing. You'll be responding to emergencies. You also would be offering personal care and all the other things that everybody else does. You can work in residential home, daycare, and nursing homes and all that as well. What are the opportunities in the future? Before then, the requirement most often is NVQ level 3 qualification, and apart from that, you would be taking responsibility of the staff under you. As I said, it's a supervisory role. You assist people with dressing and washing and toileting. Job opportunities as a senior carer. So after doing senior care work for a while, what else can you do? So you can become a care coordinator. Again, as a healthcare assistant, just as healthcare assistants, you can go ahead and do nursing, either adult, pediatric, mental health, learning disability, or anything else. Average weekly salary for care workers or support workers is about £350 weekly, but that depends on where you're working, which company you're working. So this is just a rough guide. It could be more, it could be less. What is an auxiliary nurse? Auxiliary nurse basically is the same as a healthcare assistant. I think it's a term or a title which was being used several years ago, but some people still do auxiliary nursing. They are just like healthcare assistants. They work in hospitals. They provide the same care as a healthcare assistant will do. What is the future for an auxiliary nurse? You can also work to become a nurse or anything you want to. I have met people, or people have talked about the experiences where they started as care workers or healthcare assistants, and they actually developed through the ranks, and some have become ward managers, some have become matrons because they went and did nursing and then they moved up the ladder. So these are some of the things. What is a caregiver? So the title caregiver, I think it's more of an American version of our UK carer or healthcare assistant or senior carers, but in the UK it's most often. So when you talk about healthcare assistants, normally they're working in a hospital. If you're talking about care assistant, it could be the same as a healthcare assistant. However, most often care assistants, support workers, and carers work in a communities, in care homes and all. I hope this has explained all these little titles that we have, and those of you who have asked about this question, I hope this have answered your question. If you're out there and you have a question or you have something you want me to talk about, just let me know in the comment and I will try my best. It won't be straightforward or straight away, but in a few days or weeks it would come up. So I have my usual video that I would post on Sunday, but today this is just for 2 people who have asked me to talk about care worker, healthcare assistant, senior carer, support worker, what this means. I hope I've managed to answer that question. Anyway, enjoy your weekend and I will be back. Remember to subscribe and share as well. Take care. Bye-bye.